Lack of confidence is a big reason as to why dementia residents don't communicate. And as they say, if people don't ask me my opinion, then I won't give it. And because of not being communicated with on a regular basis, dementia residents can lose that skill and with that, more confidence. Now also they have so many challenges and problems to cope with dementia. They've got recent memory loss, which is a huge problem, direction orientation loss, and then they've got all the memory blanks. And then of course coming into a dementia unit, there's so much stress around that the person can either plummet into depression or escalate up into anxiety and anger. So there's so many layers and problems to work with and to work through. And the best way is to approach this step by step, as in the books Resident's Voice and Resident's Rise I've written. It really is a methodical process, and each aspect has to be gone through systematically. Now, it is different for everyone. Some people have more problems than others. If the person's elderly, they've been in a nursing home before, maybe downstairs from the dementia unit, they come upstairs, they may hardly even know that they're in a dementia unit. Whereas if the person is younger, fit, strong, healthy, except for the dementia and memory loss, and they come into a dementia unit and they're, restricted in movement and in so many other aspects, it will be extremely stressful for them. So, for going through each of these aspects with recent memory loss, I've documented a lot of this in the videos before, but just in brief to go through each one. For recent memory loss, you need to navigate around it. So, greeting and meeting your parent, if you know that they may have problems recognizing and remembering you, just say, introduce yourself. Hi, it's Jane, your daughter. I'm here to see you. If you've been away for some time, say that so your mother can be orientated to that. And not to ask what she's had for lunch or what she's had for dinner. Recent memory loss, not intact. Talk about the past, and reminiscing and photograph albums, all of that's great. Or be in the present moment and discuss things that they can see before their very eyes. That's a very good talking point, either in the dementia unit with all the people watching or outside the dementia unit walking and enjoying the wonders of Mother Nature. Now, the next thing, direction orientation loss, a big one. It's one of the big reasons as to why people come into dementia units is because they lose their way. They can't find their sister who they've been visiting for 30 years. They can't get to the local shopping centre which they've been frequenting for a long time, etc. So the same issue, they have problems finding their room, a very big disability. And it's important to be able to orientate them to that with practice runs, lots of practice runs, getting the door identifiable with their name and their number clear at eye level so they can see it. So that's that one. The next one is memory blanks. This varies a lot actually as to how often people have memory blanks, but when you can see that your parent is looking glazed, dilated pupils, an expression of shock and just not communicating, then chances are they're having a memory blank, and when they come out of it and say, where am I, what's happening, that is the sign that indeed it has been a memory blank. So recognizing those symptoms when and if that happens again, you know that your parent is experiencing that very stressful state, and supporting that and supporting them through that with just saying, Mum, I'm here, everything's okay, it will pass soon, just relax and everything's going to be all right. And when they come out of the dementia blank, are orientating them to time and place. Now, the other thing that can happen, of course, is depression and anxiety. Both are extremely common in dementia units, and that needs to be worked with independently. So if it's depression, then the person needs to be given encouragement, support and solace, and soon after, encouragement to join in the activities, to go out walking with you, to be active. to be able to gear themselves up to living what is now their new home and environment in a dementia unit, or with anxiety, just making sure that the room's comfortable and warm and cozy. They may need some bed relaxation, but not too much so that they become bedridden, and keep the exercise going. And of course, if anger flares up, that's another really big subject, which I haven't got time for here, but I've written in depth, not so much the resident's voice, the resident's rise. I've done about 20 pages on anger here, such a big topic. Medication problems, not being able to get out of the unit because they may not want to come back in, etc. is all written there, and I've done videos on that as well. So you just need to type in Pieta Valentine, dementia, anger, and those topics will come up, just like with any other topic. So step by step. So really, for all of you out there watching this channel, best of luck, with this challenging condition. I hope this is educating you, helping you. Thank you for your looks and likes, and all strength to all of you for doing this good work with people with dementia and supporting them. Thank you.